My doctor referred me to a patient community, and in the first 2 hours after I posted a message there, I got just a ton of useful information.
I come home from the doctor's office and maybe a week later my wife will ask me, did you do this? Or what did he say about that? And I can literally go online and say, yeah, that's what we talked about, here's some answers.
The medical field is undergoing all this transformation, and it's important for us as patients not just to sit back and wait, but to get involved.
My appeal is let patients help.
Foundation support for My Health Counts is provided by Aligning Forces for Quality, an initiative of the Robert Wood Johnson Foundation, and the John R. Oishei Foundation, a catalyst for change. Produced in partnership with the P2 Collaborative of Western New York.
As advances in technology and the internet bring us closer to information and each other, a new world of participatory medicine is evolving, in which networked patients are shifting from mere passengers to responsible drivers of their health. Today, these e-patients are empowered, engaged, equipped, and enabled. I'm Susan Hunt, and today we'll show you how technology, from personal health records, patient portals, and home monitoring devices to email and social networking sites, can help you make better decisions about your health and health care.
Well, in January of 2007, I had a shoulder x-ray just for a sore shoulder, stiff shoulder. And totally by coincidence, the x-ray also showed a spot in my lung, which turned out to be kidney cancer that had spread all through my body. The median survival for my condition, according to the best evidence, was just 24 weeks, 5.5 months. I faced saying goodbye to my mother, saying goodbye to my daughter, and not to mention my wife. And then I got to work. I've always been an activated, online, engaged person. Sometimes I say that I learned how to be an e-patient, empowered, engaged, equipped, enabled, back on CompuServe on the desktop publishing forum when we people who were in the same boat talked about the problems we were having with desktop publishing software and compared notes. So that was the most natural thing in the world. My doctor referred me to a patient community. And in the first 2 hours after I posted a message there, I got just a ton of useful information. There are no sure cures. There's this stuff called interleukin that usually doesn't work, but sometimes it does. It has drastic side effects, so you got to get to a specialist hospital and on and on. I had a huge operation, 5.5 hours of laparoscopic surgery, just lots of medical miracles. And just all I did was do everything I could to help them save me. The upshot of it all was that for me, the interleukin did work. Holy cow, I thought that in the video game of life, it was game over. But instead, up popped this free replay thing. In 2007, I started a blog. I called it The New Life of Patient Dave. A couple of months later, my doctor introduced me to this e-patient movement. And I thought, holy cow, this is what I was doing. I didn't know there was a name for it. So I just renamed the blog The New Life of ePatient Dave. And then in 2009, I wrote a blog post about my electronic medical record that ended up on the front page of the Boston Globe. And I started getting invited to health policy meetings in Washington. People were contacting me saying, well, what does ePatient Dave think about this and that? I don't say that anybody should be like me. I do say that when somebody wants to get actively involved, we should give them all the information and tools and resources and advocates that we can. My appeal is not the medical establishment is corrupt or this is all a bunch of baloney. My appeal is let patients help.
And today I'm joined by Dave DeBroncard, also known as ePatient Dave on the internet, and Ligia Ricciardi, who is Senior Policy Advisor for Consumer eHealth at the U.S. Department of Health and Human Services. Wow, we are really starting to see a culture change when it comes to being a patient.
Yes, we are. The internet has changed an enormous amount, and this is a big deal. It can be hard to adjust. Culture is the shared expectations and beliefs we have about how people are supposed to act and what different people are capable of. And with patients having access to their medical records and information online and talking to other patients, they're able to do things that were never possible before.
And we're beginning the process. And when you talk about health information, we are talking about two different areas, aren't we? One, your records, and the other is just information that's available on the internet.
Yeah, so there are a couple things going on. I mean, one is for the first time electronically, many patients can get direct access to their own health record that previously would only live in an old-fashioned manila folder in a file cabinet in your doctor's office that he or she wasn't able to share with other doctors or with you. And increasingly now you can get that information online, and ideally too you can take it and you can plug it into other kinds of apps and tools, even things on your smartphone, to use it in ways that are creative and that help you meet your own health goals.
And how does it help the doctors when we have access to that? And all of you, basically all of your health team.
Well, no doctor, no nurse can possibly perform to the best of their ability if they don't have all the relevant information. I mean, one of the worst tragedies, I think, in healthcare is when something goes wrong and the doctor or nurse who is involved says, "I didn't know." And this is one of the great things that electronic medical records will address.
Also, there are incentives for doctors and for healthcare providers to take this step into the digital age.
Yeah, so we're at a really important turning point, I think, because traditionally the medical field has lagged way behind many other industries in terms of adoption of technology, and that is changing through a set of incentives for doctors and hospitals to adopt technology and to use it in ways that really improve care. That's a program called Meaningful Use, and it's run out of the office that I work for.
Is it safe, though, if our information, if that's all available?
So there are a lot of safeguards in place. Some of them are legal, like the HIPAA privacy law, that do protect your information. You also need to take a role in, if you think there's been a breach of privacy information, you can report it to the Department of Health and Human Services. But it's also important for people to be aware of their own behaviors online. So don't go posting everything about what medications you're taking or that drinking binge or whatever it was on Facebook, because the information's going to get out there. So you play a role in safety as well as your providers.
With the ability to access your medical records and the wealth of information that is now on the internet as it relates to medicine, how does this impact the dialogue that you have with your medical team and the decisions that you have to make?
Well, for one thing, it can make it a lot richer and broader. And by broader, I mean the sense that you're no longer confined to those 15-minute office visits that may occur every few weeks or months. You can have a conversation 24/7 using email, using text, using other ways of keeping in touch.
5 years ago, when my kidney cancer was discovered, it was as part of an annual physical that I had. It was an hour-long meeting, not one of the 15-minute ones. And rather than waiting until I got there and hoping I would remember everything, I sent my doctor an email in advance with 12 items that I wanted to be sure to go over. He said he was glad that I did that because he had some things he wanted to go over too. And my vision for the future is that on your doctor's website, you'll have a little thing called a visit planner, where you can drop notes, the doctor can drop notes, and treat it like any modern business.
That is a great idea. Patent it. How about self-tracking? That seems to be something that's happening, and you can see it on Facebook. People are wearing devices and tracking their health. I mean, diabetics have done it for years.
Yes, 100 years ago, as I understand it, diabetics could only check their glucose level when they went to the doctor's office. And then, the ability to test themselves at home improved. And today, the most modern is a continuous glucose monitor. Still costs a lot to do it that way, but it's better quality information. And we're starting to see similar things with people having little devices that will count your footsteps or measure the quality of your sleep. We're just in the early days of this, and to me it's exciting because it means I can be more on top of my situation without putting all the burden on the doctor.
Well, we talk about being engaged, equipped, and enabled. Obviously, this is taking us to that point. And in terms of a glimpse of the future, there's a gentleman out there that is fighting to have information that relates to something that's implanted in him, Hugo Campos.
Yeah, Hugo's a great guy. He has a complicated cardiac condition. So he has a defibrillator implanted in his chest that when his heart starts doing things it shouldn't, it'll give a little jolt, a defibrillator. Well, he is so much of an engaged patient that he wants to not just be defibrillated, he wants to learn how to avoid those episodes. So he's doing everything he can to detect, like he's figured out on his own, that drinking Scotch whiskey gives him atrial fibrillation. So now he doesn't do that. He wants to take it one step farther, not just his external observations, but he wants the raw data coming out of this electrical device. His doctor gets it, he says, let me see it too.
And having access to all of this information, I mean, is it a good thing or a bad thing? I know there's a project out there called the Open Notes Project that allows people to actually see doctors' notes.
I love it. I was one of the participants in this study. The very first time that I had a visit under that experiment, that study, a couple of weeks later, I remembered, wait a minute, wasn't I supposed to follow up on something? And instead of having to wait until the next morning to call the office if I remembered to, I just went online at 11 o'clock at night and said, oh yeah, that crusty thing on my scalp, I'm supposed to have that followed up. So we all achieved better care at no extra cost.
So why is this important for us? Why is it important for us to have access to all of this information?
So there are a
And
number
why
of
does it
reasons,
matter to me?
But I'm going to tell you one reason it matters to me. I'm a mother. I have 2 little girls. I'm also a wife. I'm also a sister and a daughter. And so I often play this traditional role that women tend to take on of health manager when something comes up for my family. And for one thing, having online health information really increases convenience. It's easier for me to get my prescription if it's automatically sent through e-prescribing to the drugstore. It's easier for me to schedule an appointment online. It's easier for me to remember or, find my child's immunization records. So convenience is one big point.
No, I believe I am an e-patient, and as technology grows, I want to become even more of an e-patient. I served in the military years ago, and what you did in the military is you carried your medical records with you. Your finance records and your medical records were number one. That medical record, if it wasn't electronic right now, probably could be a foot thick.
Okay. But I see the last blood that we released you on my chart. Did you have a chance to look at it?
Yes.
Okay. Did you have any questions about it?
No, I did not.
No. Okay. Yeah, it's nice to be able to look at your results, right? And
I come home from the doctor's office, and maybe a week later, my wife will ask me, did you do this? Or what did he say about that? And I can literally go online and say, yeah, that's what we talked about. Here's some answers. Or I can go and verify that I'm taking the right pill and the amount I'm taking is the right amount. I have been involved with enough situations where I've seen medical mistakes by poor communications. I'm getting older. I don't think of questions as fast as I used to. And with my charts, there's links. So if he says, you have whatever the Latin name for an ingrown toenail is, and I can hit that link, and it's almost like a Google. It takes you right to a page. It tells you the definition of that, what it means.
your time to manage your health doesn't always coincide with the time that I have to manage your health. So by giving you different resources like the ability to email me, the ability to update your chart, the ability to sometimes have electronic visits, the ability to access your records from other places, like if you go to another city or so on and so forth, and they can sometimes access our chart as well. Those all help to manage your care better. My goal is for you to be an expert in the conditions that you have. So if you know almost as much or as much about blood pressure as me, then I've done my job.
When I have a stroke, or when I have a heart attack, or when I get in a car accident, the more that's available to that emergency room doctor, the more I'm going to survive. And isn't that what we're talking about in healthcare, is survival? Is the taking your life expectancy and moving it forward. And information allows that to happen.
More and more Americans are turning to family and friends to share information, and I assume that's a good thing.
Yes, so we've always turned to family and friends. What's happening now is that our circle of friends can be far more global than it used to be. It's what Susanna Fox at the Pew Internet and American Life Project calls peer-to-peer healthcare. And what's possible now, what are my odds of having ever run into anybody else who had kidney cancer? Very, very slight, and yet I got connected with this expert community on acor.org, and I got superb advice, not just on treatment options, but on how to deal with the side effects. Today, my oncologist says there's no question the interleukin saved me and killed my tumors. But he said, you were really sick, and I'm not sure you could have tolerated enough to do the job if you hadn't been so informed about the side effects, so you were prepared to see it through.
And also, just going to the internet for information is not just the reason people go there. They also go for emotional support. Did you find yourself doing that as well?
Well, certainly. I mean, there's the most trained medical professional doesn't know what it's like to be dying of kidney cancer. You know, they can have worked with a lot of them. But, you know, there's a common problem that people tend to not want to go to. They say, I don't want to bother the doctor with this. You know, they're busy, they have a lot on their plate. And, you know, to be able to talk to somebody in a community like that, and by talk I mean typing, you know, at any hour of the day or night can give you great relief.
Well, you're getting all this information. You're getting it from family and friends and the internet. And there is a fear, I assume, that people are tending to self-diagnose. Is that a valid fear?
People want to understand, what is this? What's going on with me? Is it something I can deal with on my own without a doctor's appointment? You know, and it's funny because so often people in health policy or people who are trying to plan the future of healthcare remark that patients are too much of a lazy slug. But look what happens when they try to find something. Zachary Meisel, an emergency room doctor, had a piece in Time magazine a year ago where he said a woman came in with a nasty rash, and she had gone out and found website, and she said, it's like this, it's not like this, it is like this. And he wrote that it helped him make the right diagnosis. You know, being online doesn't make us doctors, but it does mean that we can be more engaged. My slogan is let patients help.
This is really a key point. When a lot of people think about health information technology, they say, are we replacing the role of the doctor or changing it somehow? I don't think of it that way at all. I think of it as really augmenting and building on the kinds of relationships that we already have with our providers and making that partnership a lot stronger than it has been.
But there are so many sites out there. How do you know which ones are the right ones to be using or going to?
We think nothing of researching all the details about what kind of TV we want or how to buy a car. We don't come to health with the same approach that my perspective is really important, and I can ask questions and I can ask a second or third opinion if I need to. I'm, you know, a really involved member of this team. In some cases, your doctor can actually help direct you toward sites that may be useful for you and that he or she has pre-vetted. But in other cases too, you may rely on peers. People that you trust is really the key thing. And we have some information on our website, healthit.gov, that can help guide you toward sites that are more likely to be reputable than others.
You know, this is second nature to people in my daughter's generation now. You look for something, you don't find what you like, you look for something else. You've still got to be a smart Googler. I'm fond of saying that I found my wife on the internet in 1999 on Match.com. And trust me, before I found her, I went through some suboptimal search results. You know, as with anything new that you learn to do, whether it's driving a car or understanding as much as you can about your medical situation, you learn, you consult experts, you talk to more knowledgeable peers. In my case, my experts are my doctors, and you get stronger legs under you and become more capable.
So the whole idea of the Facebooks and the Twitters of the world, that's all moving then into this arena of the ePatient world, isn't it?
I think that's right, and it's interesting because people are tending to use those traditional networks to share ever more health information, and at the same time there's an increasing number of new communities that are specifically focused around a particular condition like diabetes or a specific kind of cancer, and both of those can be positive things as long as people also understand that if you are in an online forum, you need to be careful to think about what information you share and what implications that could have in terms of privacy and letting people know information. As one example, a couple of years ago, I was shopping for life insurance, and this broker I'd never spoken to before said, "So, I see you recently had a baby. How was that birth? How did it go? Was it a high-risk delivery?" And I was sort of in shock. I said, "How did you know that?" And he said, "You're on Twitter."
Wow.
So you have to really think about the ramifications of what you say and what it may lead to later.
Well, we know we're talking about what we can do, but at the end of the day, the one thing that does come with all of this is responsibility.
Oh, absolutely. You know, the way I describe it is patients, the good news is you can be involved now. The bad news is you've got to be involved.
You know, I want to emphasize, though, it's important for you to be involved, but I understand that people are different, and
Yes.
not everyone feels comfortable jumping up and researching their condition in all the details. In many cases, it may be a caregiver, a family member, maybe it's a parent or a child or a grandchild even who steps in that role. But also, I think it's important to just realize that there are going to be different styles of interacting, and this kind of opens up the playing field for those who are willing and able to go much further, and just kind of opens the door for those who are willing to take baby steps too. So
Yeah.
you don't have to feel intimidated as a patient.
Yeah, thanks, Lygia. I didn't mean to convey that everybody has to do everything themselves. Now, during my treatment, there were times where I just wanted to be taken care of.
Absolutely.
And that really is the point. It's what we all really care about, is our family getting the care that it needs. Our point is just that there are new ways to help. And in the field of medical decision making, you know, we have ongoing health maintenance, but sometimes you reach a point where you've got to decide, what are we going to do about this? And it turns out that for generations, it was the physician's responsibility to basically guess what would be most important to you. There may be a range of options. And there are decades of research now where it turns out that doctors are not that good at guessing what you would want. So the modern field of shared decision making now is moving from informed consent, where the doctor has the burden of deciding and says, here, sign this, to informed choice, where you're shown a range of options and the pros and cons, and it's up to you to decide what's most important. It really is more personalized. It produces more satisfaction.
And I was just going to say, it is more personalized, and I would assume then the outcome is so much more rewarding to you, the patient.
That's right.
And that kind of gets me back to the whole point of that we really are talking about the center is the patient again.
Well, and Lygia's story with her daughter is a great example of what some people call the autonomous patient, the patient who thinks for themselves and even goes through self-education, goes beyond what the doctors might offer, with a tremendously beneficial outcome as a result.
And that story, I mean, you really should tell the story.
So I have a 2-year-old daughter, and when she was born, she was diagnosed with a hole in her heart. So we were told, my husband and I, that we should go see a cardiologist and have it checked out, which of course we did. And we were told that this was very serious and we needed to monitor it closely because blood flow that was diverted from where it should be going might stunt her growth. So we spent about the first year of her life going in to see that cardiologist every 2 months to find out whether or not we needed open heart surgery. And finally, at the end of the year, they said, it's time. We think her growth has been stunted and we don't want that to happen any further. But my husband and I had really done a lot in the interim in terms of reading about this condition, connecting with other parents whose children had had it, but also taking proactive steps in terms of monitoring her own health. So we rented a hospital grade scale and we weighed her daily and we graphed her weight, and we were able to chart her norms and compare them to those of other kids, not only in our country but in other countries, and make the point that in fact her weight wasn't so out of line with other norms. We decided to get a second opinion at another institution, and they had another test that we didn't even know about that was not available at the first institution, which showed pretty definitively that open heart surgery would not be a worthwhile thing to go through. And it's now a year plus later, and she's doing incredibly well. We avoided the trauma, the pain, and the cost of open heart surgery.
It's an incredible story. You both have incredible stories. I would love to ask you, though, what can we do now? What do we do with all of this?
I feel like in general, the medical field is undergoing all this transformation, and it's important for us as patients not just to sit back and wait, but to get involved. So the first thing we can do is to help push this change forward faster by talking to our doctors and saying, are you using health information technology? Are you using an electronic health record? And if not, when are you going to do it? So that may have implications if you're picking a new doctor too. Pick one that uses an electronic health record. So that's one thing. The second thing is you can can ask for a copy of your own health information electronically. Get that record, look at it, see if you have questions, see if there are things that are missing or possibly even wrong, and talk about it. And then the third thing, too, kind of falls outside possibly of the traditional health realm, which is take advantage of all the new resources and tools that are out there, whether online or in your pocket via your cell phone or your smartphone.
Yeah, the first E in ePatient is empowered. And an empowered person is somebody who knows what they want and speaks up about it.
I've got a great idea. Let's continue this dialogue on the internet.
See you there.
Excellent.
Over the past century, medical information has increased exponentially. Even clinicians can no longer go it alone. We all want healthcare to be better, and someday it will be. But for all of us that need care now, the best thing we can do is be involved. In this information age, it makes sense for each of us to become an e-patient, empowered, engaged, equipped, and enabled. Never underestimate the power that we have over our own health. Use technology to access information, connect with others, and collaborate in ways never possible before. Remember, My Health Counts is an attitude. You have the power to take control of your health and your health care. Visit our website and learn more. I'm Susan Hunt, and I thank you very much for watching.
Foundation support for My Health Counts is provided by Aligning Forces for Quality, an initiative of the Robert Wood Johnson Foundation, and the John R. Oishei Foundation, a catalyst for change. Produced in partnership with the P2 Collaborative of Western New York.